Pay Working Group for Thursday, August 26, 2021 will come to order. There is a quorum present. We have the first item on the agenda is approval of the minutes for August 24th. Senator Housley, would you like to make that motion?
So moved, Mr. Chair.
Senator Housley moves approval of the minutes for August 24th. Any discussion to that motion? Seeing none, all those in favor, please say aye.
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 Those say no. The motion prevails and the minutes are approved for August 24th. We have a number of items on the agenda today, including nonpartisan staff overview, the Center for Economic Inclusion, public testimony, and then discussion on criteria and next steps. And so to get things going, we will ask Ms. Fontaine, Mr. Williams, and Mr. Arneson to introduce themselves, begin their presentation, and take it away.
Good afternoon. This is Carolyn Fontaine and Senate Counsel. I will go ahead and share my screen. I will be going through the first few slides and then Mr. Williams and then Mr. Arneson. So I'm going to go ahead and, okay, let's hold on here for a second. Share my screen. Okay, does everybody see the screen? Okay. So the working group had asked nonpartisan staff to go through some programs that were assistance during COVID for businesses and individuals. And we're going to go through some programs. Some of them were monetary, actual, and they got it checked. Some other things were maybe that they were eligible for a benefit. But we separated this into 5 different categories. So the first one was support for workers. This would be unemployment benefits, the work comp, the presumption that Commissioner Robertson. Oh, I'm sorry. Okay, we're not seeing my screen. Hold on here. Hold
on.
Chair Winkler and Ms. Fontaine, I could try sharing my screen if it's not working on Ms. Fontaine's end.
Yeah, that would be great. I don't know what I'm doing here, so sorry.
Here we go.
Okay, that would be great. Can you see me talking then?
Yes, and we can hear you.
Okay, you can hear me. Okay, so we're on the slide that shows the 5 different groups that we've separated the assistance programs into. Again, we'll start with the first one, which was support for workers. That'd be unemployment insurance benefits, the workers' compensation, the presumption, and then the Families First Coronavirus Response Act. Second would be state grants to businesses. Third, federal business assistance programs, tax programs, and then the provider relief grants. Next slide. So under the enhanced unemployment insurance benefits, there were a couple of programs, and then there was that the extra supplemental payments. So the pandemic unemployment assistance would be benefits to individuals that wouldn't normally be eligible for regular state unemployment benefits. So for example, for self-employed individuals, independent contractors, gig workers, they became eligible when they normally wouldn't be, like I said, under a state program. And that was the PUA. And then the pandemic emergency unemployment compensation, that would provide additional weeks of benefits when state benefits were exhausted under the state program. So all 3 of these are federal programs that then the DEED unemployment group would run the programs for and handle the applications and that. The third new benefit was the federal pandemic unemployment compensation. These were the supplemental payments that went on top of the unemployment benefits. And I just wanted to state that these three benefit programs will end on September 4th of 2021. So you can go to the next slide. I'll just talk about those supplemental payments that went out. Oh, go back. Here we go. So from March 29th, 2020 to July 25th of 2020, this was the $600 per week of additional benefits if they were getting the regular extended unemployment benefits. Then from July 26, 2020 to September 5th, 2020, this is when there was the $600 supplemental payments went away, but Congress approved a $300 per week additional benefits. And then from December 27th, 2020 to then ending on September 4th, this was another extension of the $300 per week additional payments to applicants. You can go to the next slide. This, the workers' compensation, this is the presumption for COVID-19 claims. And Commissioner Robertson really went through this in great detail and provided wonderful information on this presumption. But anyway, it was in Laws 2020, Chapter 72, which amended a workers' compensation statute that's the definition of occupational disease. And it just provided the presumption that an employee in one of these categories that's listed was presumed to have an occupational disease arising out of employment. And then they needed to satisfy certain requirements. Again, Commissioner Robertson went into this. And what she also mentioned was that there were a lot of claims by other individuals that would not have qualified for this presumption, such as the food processors, the meat processors that were denied or did not qualify for the presumption. So then you can go to the next slide. This is a federal program, the Federal Families First Coronavirus Response Act, the FFCRA. This required employers to provide paid time off. And this was for employees of private sector employers with fewer than 500 employees, and then certain public sector employees. So they became eligible for up to 2 weeks of fully or partially paid sick leave for COVID-19 related reasons. So for example, if they were exposed to COVID, or if some relative had COVID and they needed to stay home, quarantine for those reasons. Again, the employer paid for this. This was required by this act, but it was paid for by the employers. However, certain sectors under the law were excluded from the requirement. So healthcare providers and emergency responders, employers could exclude them from this paid sick leave requirement. And this was applicable only from April 1st, 2020, and it ended December 31st of 2020, this requirement. And you can go to the next slide. There were two rounds of state grants to businesses. The first one was passed in Laws 2020, first special session. This was in June of 2020. This was the Small Business Relief Grants Program, and it was $60 million from the Coronavirus Relief Fund. Priority was given to businesses that were restricted from operating under this certain executive order that limited capacity to 51%. And the grant amounts, maximum amount was $10,000 to a business. There were some carve-outs for micro businesses that they got some priority. Then cultural malls were eligible for up to $250,000. And then also some requirements for dollars to go to businesses that were owned by minority individuals, women, or veterans. Then the legislation specified that grant funds could be used for working capital, and that could go to payroll. So that could go to individuals to keep them on the payroll, rent, mortgage payments, et cetera, that had occurred since the pandemic started, for expenses that occurred in the regular course of business. You can go to the next slide. The second state round of state grants was in December of 2020. And this was kind of 3 different categories. The first was the business relief payments, and this was $80 million of general fund. And these were automatic payments that went out. So there was no application. These went to certain businesses that had certain codes that the Department of Revenue that was identified in the legislation for restaurants, fitness centers, et cetera. And then depending on the number of employees, they would get, that would determine the size of the payments that went out between $10,000 and $45,000. There were also some grants to movie theaters and convention centers. That was $14 million of general fund. And finally, there was a county relief grants that were to go to local businesses. That was $114.8 million of general fund. And that was a pretty, it allowed quite a bit of flexibility for the counties. And it just really specified that the business had to be impacted by an executive order related to COVID-19 pandemic, and that they could be used by the eligible business or nonprofit for operations expenses. You can go to the next slide. Oh, and that concludes my portion, and Mr. Williams will take over from here.
Chair Winkler and members, I'm going to talk next about the Federal Paycheck Protection Program. I think a lot of people are familiar with this, so I'm not going to go into all that much detail, but happy to answer more questions if they come up. The program was initially approved in the CARES Act in March 2020. It was expanded and modified by Congress in several future acts. The program provided forgivable loans to small businesses and nonprofits. To qualify for loan forgiveness, businesses need to maintain employee and compensation levels. The maximum loan amount was 2.5 times the average monthly payroll cost in 2019 or 2020, up to $10 million. The amount of loan forgiveness is essentially the amount you spent on eligible expenses that were paid out 8 to 24 weeks after the loan was dispersed. Of those eligible expenses, 60% had to be payroll costs, but the other 40% could cover things like mortgage interest, rent, utilities, certain covered operations, property damage. You see some other items listed there. The loan payments on these loans were deferred for 10 months after the covered period, but presumably businesses that paid out enough eligible expenses to qualify for loan forgiveness would never make loan payments on those loans. Sorry about that. The eligibility criteria for this, businesses had to meet this, either meet the Small Business Administration's definition of a small business concern. The SBA has different definitions based either on revenue or the number of employees for different sectors. So I didn't go into too much detail there, but businesses or nonprofits who had 500 or fewer employees were also eligible. And then there were certain other organizations like housing cooperatives with 300 or fewer employees were eligible. I'd also note that some businesses were eligible for so-called second draw loans of up to $2 million. And there's some data at the bottom there. There was about $11.2 billion paid out to 102,000 Minnesota businesses in 2020, and $5.3 billion paid out to 126,000 Minnesota businesses in 2021. Briefly talking about a few other federal business assistance programs. There's so-called EIDL, Economic Injury Disaster Loans, that the Small Business Administration offered. Those are non-forgivable 30-year low interest rate loans to small businesses that had to meet financial obligations and operating expenses, but were experiencing economic impact from the pandemic. That was $3 billion in loans to 42,000 Minnesota businesses. There was a restaurant revitalization fund. Those were grants of up to $10 million equal to pandemic-related losses. It was $10 million per business and $5 million per physical location. There was about $525 million of those grants provided to 1,700 Minnesota businesses. There's a shuttered venue operators grant program. Those were grants to venues, theaters, theatrical producers, museums, and movie theaters. The grant amount was was equal to 45% of gross revenue, up to $10 million, and there was 177 million distributed to 226 Minnesota businesses under that program. There's also the COVID-19 targeted EIDL advance program. This was kind of related to the EIDL program, but there were up to $10,000 loans for businesses with fewer than 10 employees who are located in low-income communities and experienced a 50% revenue loss. The targeted EIDL loans were forgivable, however, so that distinguishes them from the EIDL loans. And there's $37 million provided under that program to 4,000 Minnesota businesses. Another program that I think many people are probably familiar with are the economic impact payments or stimulus payments. These were 3 rounds of direct cash payments to individuals provided by the federal government. There was a phase-out schedule that was varied somewhat between the different rounds of it, but it generally started at $75,000 of adjusted gross income for individuals, taxpayers, and $150,000 for joint returns. The CARES Act gave $1,200 per adult and $500 per child under age 17. So there was a total of $4.72 billion paid to Minnesota under the CARES Act. There was a separate COVID-related Tax Relief Act and the Consolidated Appropriations Act last December. That program provided $600 per adult and $600 per child under the age of 17. The federal government has not yet released any data at the state level about how much was paid out through that round of stimulus. And the last one was the American Rescue Plan Act, or ARPA checks. Those were $1,400 per adult, $1,400 per dependent, and it was not limited to dependents under age 17. And the ARPA stimulus or economic impact payments totaled $6.56 billion, and there's 2.67 million recipients. The federal government also provided certain exclusions from gross income that Minnesota picked up. So these are essentially forms of income that were not taxed, sort of deviating from the normal tax base in the last couple of years. So the unemployment insurance exclusion from gross income was up to $10,200 of compensation per recipient of UI. That exclusion was fully phased out immediately at $150,000 of adjusted gross income. The Joint Committee on Taxation estimated that was about $24.96 billion federally, so across the United States. So if you sort of prorate that down to Minnesota based on our share of total adjusted gross income, it's about $464 million in tax relief to Minnesota residents. And the Department of Revenue, their revenue estimate for this provision, which we conform to for state tax purposes in the 2021 Omnibus Tax Bill, the Department of Revenue Research Department estimated a state tax reduction of $34.8 million in fiscal year 2022. And this applied to only UI payments made in tax year 2020, so last year. There's also a tax preference for the Paycheck Protection Program. So first, the sort of 2 parts of this tax preference were loan forgiveness under PPP was excluded from gross income. So typically forgiven loans are considered income and subject to federal taxation. And additionally, Section 265 of the Internal Revenue Code was suspended. So the general rule under the Internal Revenue Code is that non-taxable income expenses that are associated with non-taxable income are not allowed to be deducted. But in the December appropriations bill, Congress suspended that section with regard to the Paycheck Protection Program. For reasons having to do with how the JCT scored this proposal, there was actually no federal estimate provided for the revenue reduction, but the Department of Revenue estimated that there's a state tax reduction of $409 million in the 22-23 biennium and an additional 45.7 in the 24-25 biennium. And I'd lastly note that this treatment of PPP loans was also provided to the other federal business assistance programs that I mentioned. So similar treatment was provided to the shuttered venue grants, to the targeted EIDL loans and those sorts of things. Lastly, there was in the American Rescue Plan Act, temporary tax credit expansions. So these were one-time expansions of certain federal tax credits. So the child credit was increased from $2,000 to $3,000 per year for children ages 6 to 17, and actually increased to $3,600 per year for children 5 and under. This additional amount was phased out at $75,000 of adjusted gross income, $150,000 for married couples, and the credit was made fully refundable. So there was sort of an earned income phase-in for the refundability of the credit that was eliminated. And you may have heard in the news that there's also advanced payment of these credits. So the additional amounts being paid out on a monthly basis. There was also an expansion of the earned income credit. So particularly for childless filers, the maximum credit was tripled from about $543, I guess almost tripled from $543 to $1,502. There was also a reduction in the eligibility age from 25 to 19 for most filers. And lastly, there's a dependent care credit. This is the credit for childcare expenses. And the maximum credit under the dependent care credit was increased from $1,050 to $4,000 for taxpayers with one dependent, and then from $2,100 to $8,000 for taxpayers with two or more dependents. The credit was also made refundable. The federal credit was previously not refundable, although the state credit was. And then the phase-out thresholds were also increased. And Mr. Arneson is going to discuss this provider relief grants program.
Mr. Chair and members, this last slide describes the provider relief fund or provider relief grant program that was established in the CARES Act. We received a special request to overview this program for you in the committee. This grant program provided direct payments to eligible providers who diagnose, test, or care for individuals with possible or actual cases of COVID and have healthcare expenses and lost revenues attributable to COVID. And the stated goal of the program was to essentially to maintain the national health system capacity. The latest information from Federal Funds Information Service indicates that there was about $1.8 billion in payments to eligible Minnesota providers. Though I checked this morning with the Health Resources and Services Administration data warehouse, and I think the revised number is going to be somewhat larger than that, perhaps in excess of $2 billion. When it's all said and done. In the context of this program, providers would include large health systems all the way across the spectrum to relatively small, perhaps one-person provider offices. The allowable expenses were quite broad, including any expense used to prevent, prepare for, and respond to coronavirus. The payments were generally in proportion to that provider's share of 2018 net patient revenue. So kind of like almost, at least initially, like a kind of a baseline support for these providers. There were also targeted distributions directed toward high COVID impact areas, certain safety net hospitals, rural hospitals, skilled nursing facilities, and payments to Indian Health Service providers. Members may also recall that the state in laws 2020, the regular session 2020, in Chapter 70 enacted a somewhat similar program called the COVID-19 Healthcare Response Grant. That program allocated about $150 million from the general fund to eligible providers, and in many cases, the provider list for that state program would be very similar to the provider list for the CARES Act program. In terms of order of magnitude, the state program is less than 10% the total payments, but certainly important for many providers in supporting the extraordinary expenses that they incurred responding to the pandemic. And that concludes this slide.
Thank you, Mr. Arneson, Ms. Fontaine, and Mr. Williams. Questions from the working group? I'm not seeing any hands going up, but we can always come back. I know you will be here as you are at every hearing. And the next item on the agenda is the Center for Economic Inclusion. Tawana Black will make a presentation. So Ms. Black, if you could please identify yourself for the record and begin your presentation.
Good afternoon. Thank you very much. I'm Tawana Black. I'm the founder and CEO of the Center for Economic Inclusion. I will now share my screen in order to present for this discussion. Thank you for the opportunity today. Can you see my slides right now? Thank you.
Yeah.
Excellent. One moment. Thank you, Mr. Chairman and members of the committee for this opportunity to present to you and share information, again, following the letter and memo that we shared with you previously and communication individually with you all. On today, we have the opportunity to share a bit from the Center for Economic Inclusion, where we work to equip employers, policymakers, and state and regional government entities with knowledge, tools, and resources to dismantle institutional racism and catalyze an economy that works for all of us. I serve as a member of DEED's Economic Security Advisory Group, and over the course of the last year, my team and I have partnered with many local, state, and regional government agencies, community-based organizations, and business and philanthropic organizations and leaders to advise and build strategies that both maximize both CARES Act funding, federal funding, and local and state regional dollars that have all been committed to ensure that we not only recover from the last year's pandemics, but also that we build a future that is right for all Minnesotans and ensure that all people have an opportunity to truly prosper in our economy by maximizing and leveraging these federal funds. And I'm honored to share the opportunities that we've been able to co-create in partnership with our community of Minnesotans today. Frontline workers have been centered in these opportunities in ways that we haven't seen before, and we want to take full advantage of really centering low-income workers who don't have options for paid leave at this time, and those workers and groups who have been disproportionately impacted by the COVID-19 pandemic, including workers of color and immigrant workers who have been impacted the most, in particular have had increased hardships, and those who frankly were behind in our economy far before COVID-19 came into our state and into our country and faced some of the greatest hardships. We have an opportunity, though, to really be data informed as we consider the impacts of this pandemic on us and the opportunity to leverage these dollars in order to drive real systemic change in our economy and ensure that both employers and workers thrive in the future. We see this as an opportunity for us to really zero in on studying the data. Pandemic-related layoffs have disproportionately affected women, our Indigenous and Black Minnesotans, and the difference in industry and occupation-related changes only explain a fraction of these job losses. According to Minnesota Compass, more than 8 in 10 Black employees and more than 7 in 10 American Indian employees have filed for unemployment claims during the COVID-19 pandemic, compared with more than 4 in 10 non-Hispanic white employees. More than that, we know that the wage gap has accelerated in recent years by more than 20% increase than the Black-white wage gap between 2000 and 2020. It's important that we're cognizant of this as we understand both the starting point where our economy was as it relates to frontline workers and where we are today, and how we can maximize resources in order to ensure that our entire economy and everyone in it moves forward by maximizing every dollar that we can at this moment. The opportunity before us is one that allows us to invest in really driving investment in those businesses that are also on the front lines and the workers that they have. And we'd like to elevate a couple of solutions that we've seen in other states in order for this committee to really consider ways to really stimulate economic growth in a way that's both inclusive and equitable. McKinsey has highlighted a couple of those examples. We lifted up for you here today one example from Pennsylvania, where policymakers invested $50 million of these types of dollars to help over 600 businesses increase their hourly wages in order to ensure that these workers on the front lines who have borne the most breadth of our pandemic were able to move forward in the economy. Zeroing in on both healthcare workers and the food industry, they're able to ensure that solutions are both strategic and focused on the economy, having a deliberate focus in the communities, a high impact, and a focus on economic growth. And you'll see me talk about these 3 areas of opportunity with a couple of examples before us today. We also wanted to highlight an example from Maryland, where policymakers chose to invest in 14 industries and sectors, investing 25 to 35% of the labor force to provide workers who are earning less than $100,000 a year with a $3 hour increase in hazard pay. Again, in this case, we see a focus on a high focus, zeroing in on particular sectors, particular earners who are earning less than $100,000 a year, but also having a high impact because we're seeing a benefit on those industries who are desperate for workers, not unlike what we see here in Minnesota. And again, in contrast, Seattle chose to have a less impact with their effort. And we want to be sure that in Minnesota, we're not taking this approach where they mandated grocery stores with over 500 workers provide their workers hazard pay, increasing that pay by $4 an hour. But that flat rate meant that all workers, regardless of compensation level or hardship, received the same amount. We'd note that here in Minnesota, we're hearing, particularly in the healthcare sector, where we have clients and partnerships, physicians and others who have been high wage earners, individuals who've had an opportunity to not just be able to sustain themselves through the pandemic, but have been able to thrive and increase their investments and their rewards more than ever through this pandemic, saying it isn't in our best interest as a state to reward everyone equally, but this is a time to invest equitably, to take the data and let it inform our approach, to take the data and let it inform our future by making sure that we're investing in ways that sustain us all, but do so in a way that considers who has borne the brunt of this, not just in the hours that they've worked or where they've worked, but who's borne the brunt of this economically, and ensure that our state is better off in the future by ensuring that all workers can thrive and that we've used data to drive those decisions. We want to highlight the economic impact to our gross domestic product, our regional domestic product, by focusing on closing the racial wealth gap in our communities across the state of Minnesota. McKinsey's data from Brookings, data from the Economic Policy Institute, every entity that has studied this issue for the last 5 to 10 years comes up with the same information, that if we focus specifically on closing racial wealth gaps, we add exponentially to our gross domestic product. It is good for everyone in our communities when we make targeted strategic investments in those workers who go to work every day, but are not paid equitably in order to thrive in our economy, who suffer still today from history. We can do this by helping employers increase wages, by using these dollars that are in your hands strategically to help employers in specific sectors move forward by investing in their workers. Unlocking the full economic potential of our communities of color helps all of our regions across the entire state of Minnesota move forward. Studies done by the Met Council and Economic Policy Institute and PolicyLink show that just here in the Twin Cities, the 7-county metro, this would add more than $30 billion to our GDP by focusing on closing just the wage gaps. We can do that by helping employers and by connecting those employers to organizations like ours and our peers so that they have the strategic tools necessary to continue that wage bump after these dollars expire. We know that this isn't done only by focusing on large employers or even mid-size employers, but must also include those small businesses on the front lines of our economy, businesses that are owned by our Black, Indigenous, Asian, and Latinx communities. And we've seen the data point us to the need to ensure that those businesses are thriving as well. We've seen great investments, not only by the state of Minnesota, but also by our counties and our local governments, by our foundations, and a huge focus on investing in these businesses through supplier and business diversity by our large corporations in the state of Minnesota. And the data shows that when we focus in these areas, we also see exponential returns to our state. We encourage you in closing that the choice is ours to really invest strategically, to invest with focus on specific populations in our state who need this investment, to focus on businesses who are at the front lines and are desperate for workers who will invest in them, be loyal with them, and can see us through to an economy that doesn't just take us back to where we were, but take us to a brighter future, one that's equitable, one that's inclusive, and one that allows everyone to prosper. I thank you for this opportunity and happy to answer any questions that you might have.
Thank you, Ms. Black, for that presentation. Very concise and focused, and pointing out a reality that this community has long been unable to address adequately. So thank you for that. Questions from the committee? Okay, I don't see any questions. If we have them come up and you're still around, we'll go back to you, Ms. Black. Otherwise, I know that others can follow up with you directly. So thank you for your presentation. Next on our agenda is
Mr. Chair.
I'm sorry.
No, I'm sorry. I got my hand up late. This is
okay. Representative Fraser. Representative Fraser, go ahead.
Mr. Chair, Ms. Black, thank you for this presentation. It was good. Again, it highlights the historical inequities in the wages for many of our workers and many of the workers that were essential workers and on the front lines on a day-to-day basis and still are in the middle of this pandemic. I had one question I'd like to get your, I don't know if you have the answer to it, but I'd like to just get your thoughts on where you think it may go. If we were to use the resources that we have to increase the hourly wages, it's only $250 million, it would be for a short period of time. Is it your understanding that this would somehow spur the employers to actually take up that and continue that increase after that money has been depleted?
Ms. Black?
Yes, thank you, Representative. I appreciate that question. And yes, that is the approach that we would recommend and an approach that we've been encouraging as we talk to both employers, but also state and local and regional government entities as well, where we've been encouraging a multiplier effect, letting them know that we are also advocating for this here, but we're advocating for similar investments at our county governments for their investment of the ARPA dollars, and believing that employers could then, through strategic work by their ability to accelerate their productivity and profitability, be able to invest that back into keeping those wages at the higher levels.
Representative Frazier?
Thank you, Mr. Chair. And Ms. Black, thank you. So do we know from any of the examples that you gave, have any of those employers committed to maintaining those wages, those hourly increases?
Ms. Black?
We do not know at this stage if the states that we lifted up right now have written it into their agreements. I believe they're early enough in theirs that they have not moved into that requirement for these particular dollars. That said, there have been other states that have done similar approaches using other both state and federal dollars, as well as philanthropic and private dollars to do similar approaches for temporary wage increases that then require employers, not unlike what we see for economic development, where we're incentivizing employers to come into a marketplace, often incentivizing them to hire from a particular zip code by subsidizing wages for an entry period of time and encouraging or requiring the employer to take over that subsidy after a point in time and to keep it at that level after that initial subsidy ends, whether that's through things in my history of economic development. We've done this with things like tax increment financing for the first period of investment. So this isn't a new approach. It's new in terms of what the source of dollars are and the need to then have it standardized within the agreement.
Representative Frazier?
Thank you, Mr. Chair. Ms. Black, thank you for this. I do think we need to find ways to spur these employers, and particularly those employers that have done very well. As we know, this has been an uneven, the pandemic has been uneven on how it's impacted some employers and some workers. Some employers have done very well. I think they've done what we know they've done very well because of the essential frontline workers that have showed up day in and day out, been dedicated to help push their industry and push their services. And I think that any of those employers that have done very well and have seen their resources and their wealth increase exponentially during this pandemic, they should find a way to increase those wages. But I do like the idea in any ways we can spur them to do so. But I always think about systemically, this is an issue, it's a historic issue. And I don't know if this one-time money will be able to fix it, but if it could find ways to spur employers to fix the historical low wages, I am all in for that. Thank you.
Senator Kiffmeyer? We can't hear you, Senator Kiffmeyer.
Okay, I think you can now.
Yes.
I have to actually unmute in two spots when situations in order to make sure I have a good signal. At any rate, Mr. Chair, I appreciate the information from Ms. Black and Representative Frazier's comments. However, this work group, I think, mainly has been tasked with using this money to appreciate what has been done in the past. So the risk level federal rules that we have right here, I don't know that this is necessarily the task of our task force. Might be a valid discussion in another place, but I think for the purpose of this work group, it is much more looking back at those who have already put forward the extra effort, and also especially those with an extra risk that has been involved due to the pandemic. So I think it's important, Mr. Chair, to get this information. It's excellent. We're glad to have it. I think we really need to stay focused on the purpose of our particular work group. Thank you.
Thank you, Senator Kiffmeyer. I think it is useful to have the information to kind of, especially so concisely, show the impacts and to be mindful as we're thinking about how to make our best impact with the funds we're distributing, to keep those things in mind. This is just kind of a side note, but as I am working on this working group, I think back to the spring of 2020, when we were working on the presumption for workers' compensation and trying to reach many of these same groups. And, I'm hoping that this working group and this $250 million is part of a continuing effort to recognize the contributions of workers and the benefit we all get when more people are able to support themselves and their family through compensation. So it might not be the perfect fit to look at ongoing future pay increases here, but I think it is valuable. And we've seen throughout this pandemic experience and the funds made available that our intervention with the resources we have available does matter and make a difference. So I'm glad that we're all getting this information, and I hope it informs our policy making going forward too. Senator Murphy.
Thank you, Mr. Chair and members. And I also want to thank Ms. Black for her testimony. And it's brought to mind two things that I think are current for the work that we're doing. And one is the sometimes unexpressed impact on communities of color that the virus has had on health and on economic well-being. We know lots of low-wage workers are people of color disproportionately. So some of what we're doing in this working group is, with that harm in mind. The virus has also impacted the health and the lives of people of color disproportionately. And I think it's important to continue to remind ourselves of that on the record. The second issue that has come up that is not necessarily a part of this work group, as Senator Kiffmeyer has acknowledged, is the ongoing need to address the combination of low-wage work and a workforce shortage in critical sectors like healthcare and childcare, in manufacturing, et cetera. And while this ARPA money and the task of this group is not to address that fundamental problem, I do think, because it has been raised, because of the duration and ongoing nature of the pandemic, and because we are hearing from the testimony in this committee that those workforce shortages are altering the working situations for the people from whom we are fighting in this working group. It's important that we are thinking about that, considering that, both in these deliberations and in the work that we're doing going forward. So, Mr. Chair, I'm grateful that we've had this testimony. And I think it is critical as we are thinking about the short and longer term future of Minnesota that we contemplate what we're hearing. Thank you.
Thank you, Senator Murphy. And thank you, Ms. Black. I think we're ready to move on to our next group of testifiers. I have Rachel Hanneman, Mark Husband, Dan Gorman, Sherman Phillips, Katie Kramer, Yosenta Jackson, and Marcia Milliken on my list. And that's the order we'll go in. So we'll start with Ms. Hanneman, then we'll go to Mr. Husband and Mr. Gorman. Rachel Hanneman.
Hi, are you able to hear me?
We can hear you. Please identify yourself for the record and begin your testimony.
Hi, I am Rachel Hanneman. I am a certified registered med-surg ICU nurse.
Please proceed.
Thank you. I currently live in Savage. I've been here since 2009, where I live with my two children, ages 3 and 7. And I started working for Fairview back in 2011 as a certified nursing assistant in a nursing home prior to becoming a nurse and working in several of Fairview's hospitals before I took an assignment at Bethesda's COVID ICU last summer. And then that closed in October. After that, I continued working in the COVID ICU at St. Joseph's Hospital, doing COVID cares up until that closed in May of 2021. So I've been working with Hennepin Healthcare in the trauma ICU since then. And I'm here today because it's important for me to speak about the task force and help the public understand how you are able to support us, all of us frontline workers actually, who risked so much to protect our patients and our communities last year during the pandemic. And I'm here today to speak about the importance of that frontline workers' pay specifically. This would go a long way to those of us who burdened the most risk last year with exposures and infection, and actually bringing that home to our families where it could possibly spread. And we're just looking to be recognized and supported at this time. We assumed so much risk last year throughout all of this uncertainty with contracting COVID. And this was something that had no treatment plan, no cure, and no vaccine at that time. So even prior to this pandemic, nurses were leaving the bedside at pretty high rates. They were looking for higher paying jobs so that they could dig themselves out of the burden of student loan debt that put them into the job of being nurses. And they were looking for safer jobs away from some of the violence and some of the sexual harassment that we faced at the bedside. So even prior to this pandemic, nurses were facing risks. And even now they're leaving the bedside because the risks are still there. And now we have the pandemic on top of that. So things aren't slowing down for us. So whether we took care of you last year in the hospitals as you were sick and fighting COVID, or you stocked grocery shelves so that we could all feed our families, or whether you took care of our children so that we could go to work and do these jobs, we all faced contracting COVID as an essential worker. So if you were sick or exposed and had to quarantine, you had to make the choice between staying home and paying yourself and looking after yourself that way. Hi. So you either had to stay home and pay yourself out. You had to maybe stay home and lose pay, take care of yourself without a paycheck, or you had to go to work sick if you didn't have any of those options available to you. And right now, with starting fresh at my new job, I really don't have any hours saved up or accrued as I work at Hennepin Healthcare in the ICU right now. That hasn't happened for me yet. So I have only 30 hours. And if I get sick, that's less than a week of pay for me. So staying home is out of the question, and I have to go to work. Last year, I was exposed and I saw my patients on ventilators for 3 to 4 weeks at a time. I chose not to quarantine because if I actually got sick, my family needed every single one of those sick days so that they could take care of themselves, because there was no safety net for me at that time. So I made the choice to continue to go to work, even though I didn't have any negative testing yet, because I just couldn't afford to stay home and wait to hear that I was going to be okay. Even though last year there was a lot of buzz and it sounded really good to call us frontline workers and heroes and essential, we were still people who still had families and jobs and responsibilities. Nothing protected us, not those statuses. It didn't make us any safer. So we were still at risk. And with all of that stress last year, I went through a divorce and had to find employment as those 2 hospitals closed. So that safety net, or any extra income that I earned with overtime, that either went to funding my divorce, that got split in my divorce, and then that went to childcare this summer, as I had to pay for daycare for both of my children while I went through training at my new job. So my safety net is completely gone and depleted. I had to take up work as a second job as a nurse with a travel agency this summer just to recover financially from everything that I went through so that I could start establishing a life with my children now after all of that. Last year, hospitals made record profits, and nurses, in order to become a nurse, you have to go to school for that. There's no other way to do my job. So even though they were making profits, I'm still sitting here in student loan debt just to save lives going forward, even after all this is done. And if we hadn't been willing to do that, I don't know who would have staffed the hospitals. And I still 7 to 8 more years before my loans are going to be paid off. So I'd just like to take this minute to think of you guys and to ask you to take care of us the way you would have wanted us to take care of your families if you had gotten sick last year. Take care of the frontline workers the way we would have taken care of you. We're asking for that now. We could have used it then. We desperately need it now. There is nothing left for a lot of us. A lot of these programs or some of these privileges the employers offered, those have gone away. So right now, we're just asking to give us some of the respect and some of the help and support that we deserve after everything that we did last year to keep the pandemic moving. So thank you very much for your time and this opportunity.
Thank you, Ms. Hanneman, for sharing your experience and your story and for the work that you're doing. And we are working hard to figure out the best way to get this money out the door to the people who need it and recognize it. So thank you for your testimony. Mr. Husband, you are next, followed by Mr. Gorman. So Mark Husband, if you could identify yourself for the record and proceed.
My name is Mark Usman.
Husband.
Good afternoon, Chair and Commissioner. I live in Sandy. I'm here today to voice my support this working group in favor of providing front workers pay for grocery and meat packing workers. I'm a meat cutter and a UFCW Local 663 member at Cub Foods in Crystal. I've been a journeyman meat cutter since 1991. Before COVID, a typical day was easy. I go to work, come home, spend time with my family. After COVID began, there's no longer good days at work. I worry now going to work every day. Try to protect myself the best I can for myself and for my family. The scariest part of it is I'm risking my family's health by going to work. I got COVID in November. I was out for 2 weeks. The first week was actually deer hunting. I kept falling asleep in my deer stand. I figured I had COVID and I had to rush home to get tested. I quarantined in my room, but my wife and daughter got infected. My other daughter and son were okay. I would take it minute by minute sometimes. Honestly, sleep is 16 hours a day. I have never felt more sick in my life. All you do is think about your family. I thought if I die, I lose my pension, then my family would have nothing. I feel better now, but I go home from work exhausted. I can't even go outside and work. It seems like I've lost a lot of energy from having COVID. COVID has changed my life forever. Now I especially take every single precaution to prevent getting it or spreading it again. My feeling about the frontline worker pay, everybody should get a piece of the pie. Customers will come into our stores without masks, yet the companies are too scared to lose a customer and not allow them in our store. To me, that's unacceptable. That would never fly in a hospital setting. I think that those workers in retail are some of the most at risk because people come in without protection. Please make it a right and provide frontline essential workers pay to all grocery and meat packing workers for the service we continue to provide for our communities. Thank you for your time.
Thank you, Mr. Usman, and hope that your recovery continues. Next, we have Dan Gorman, followed by Sherman Phillips, and then Katie Kramer. Mr. Gorman.
Good morning. I'm sorry, good afternoon. My name is Dan Gorman. I'm a corrections officer out of Stillwater Correctional Facility. I'm a member of ASME Council 5 and the president of ASME Local 600 at MCF Stillwater, where I've worked for the last 16 years. I'm testifying on behalf of the ASME Correctional Policy Committee, which represents correctional officers at all of Minnesota's correctional facilities. Since the pandemic swept across Minnesota last year, we have had over 4,200 confirmed or presumed cases of COVID in our facilities. My coworkers and I have been on the front line of this pandemic and continue to risk our safety to keep Minnesotans safe. Please include correctional staff in the frontline worker pay. The earliest months of the pandemic were the most demanding for us. Before vaccines were available and before we really knew what we were dealing with, when workers all over the state were protected by the stay-at-home order, and just as the virus began spreading through our facilities, correctional staff live with the daily threat of contracting the virus and spreading it to our kids and our spouses. Prisons are a petri dish for a virus like this. Congregate living with all non-porous surfaces, and stale air. It's not feasible to keep all these surfaces clean dealing with the populations we do. And remember, early on, there were so many unknowns. We had members sleeping on cots in their garages or in their driveways and ice shacks to protect their families. Parents who couldn't embrace their young children or hold their babies because they were certainly exposed to the virus and didn't want to endanger their families. Our families were exposed and contracted COVID due to us showing up and doing the work. Luckily, so far, I have not personally brought it back to my family, but I know officers who definitely did, and who, along with their spouses, spent months recovering. Some still have not yet. The department has recorded over 1,000 staff at facilities around the state who have tested positive with COVID so far. Our exposure is a documented fact, and we deserve to be included in whatever frontline worker pay this group recommends. Thank you very much for your time and allowing me to testify today.
Thank you, Mr. Gorman. Next, we have Sherman Phillips, and he will be followed by Katie Kramer. Mr. Phillips.
Good afternoon. My name is Sherman Phillips, and I'm a business representative with the International Association of Machinists and Aerospace Workers, District Lodge 77. I'm here today on behalf of Connor Robbins, who is a nutrition service equipment technician for the St. Paul Schools District and a member of Local Lodge 459. Connor is responsible for repairing and keeping all the machinery at the kitchens in working order. This includes ovens, refrigerators, dishwashers, and more. The schools rely on Connor's expertise and skills to safely and efficiently feed their 38,000 students each day. In addition to these duties throughout, he has worked side by side with the nutritional service workers, making boxes of food available for pickup and delivery. Connor's technical skill in keeping the boxing machine running was essential to the district's ability to ensure thousands of children and families had nutritious meals during a time when so many parents struggled to put food on the table. He did his best with the masking, distancing, sanitizing, but still feared catching COVID and bringing it home to his family. All of Connor's coworkers and supervisors received heroes pay as part of the federal stimulus, but Connor did not. As you decide who will receive frontline worker pay, please keep in mind all of the people like Connor who maintain, repair, and assemble the equipment that allows other frontline workers to do their jobs. I would like to thank you for allowing me to speak today and tell Connor's story.
Thank you, Mr. Phillips. Senator Kiffmeyer, I see your hand is up. Do you have a question?
Mr. Chair, I do have a question, but I will wait until the testifiers have completed. Maybe not so much a question, but just some more information. Thank you.
Okay, thank you, Senator Kiffmeyer. Next is Katie Kramer, followed by Yosenta Jackson and Marcia Milliken. Ms. Kramer.
Chair Winkler and members of the Minnesota Frontline Workers Pay Working Group. My name is Katie Kramer, and I am the Policy Director for Violence Free Minnesota. I'm here testifying on behalf of each of the 5 statewide coalitions working to end violence and abuse. Violence Free Minnesota, the Minnesota Coalition Against Sexual Assault, as well as the Minnesota Alliance on Crime, Mending the Sacred Hoop Coalition, and the Minnesota Indian Women's Sexual Assault Coalition. Our 5 statewide coalitions represent more than 100 programs who provide domestic and sexual violence services across the state and all 87 counties. In collaboration, Minnesota's coalitions working to end violence and abuse request that victim advocates working in shelters and providing direct services to victim survivors of crime be included in the pool for frontline worker pay. Domestic and sexual violence programs provide essential services. During the 2011 government shutdown, our programs were named critical core functions of government. We continue to be considered essential services. Under Governor Walz's Emergency Executive Order 2020, directing Minnesotans to stay at home, our services were exempted as critical essential services. Indeed, our programs across the state remained open, providing services for those experiencing abuse or violence at home. Our programs have a direct and immediate impact on the public safety, health, and well-being of Minnesotans. For 2 weeks at the start of the pandemic and immediately prior to the stay-at-home order, calls coming into the statewide Day 1 crisis hotline were up 10%. For the week of March 2nd, 2020, the first week of the stay-at-home order, hotline calls increased by 26%. All of our shelters, parenting time centers, and programs providing direct services had to juggle continued or increased demand for shelter and direct services while struggling to access protective gear and cleaning supplies for their congregate living spaces in order to maintain the health and safety of themselves and those in shelter. This put shelter workers and advocates at increased risk and exposure to COVID-19 during an incredibly chaotic and uncertain moment in history. When victim survivors of domestic and sexual violence reach out for shelter or services for themselves and their children, victim advocates must be present to meet a wide variety of needs during an incredibly frightening time of crisis for families. As our advocates provided these essential in-person services during the additional crisis of the COVID-19 pandemic, and again now with the surge of the Delta variant, they have and continue to assume higher risks of contracting COVID-19 in a congregate living environment. We appreciate your consideration of victim advocates in shelter, parenting time centers, and direct service organizations in the pool of frontline worker pay for serving on the front lines supporting some of our most vulnerable community members. Thank you.
Thank you, Ms. Kramer. Next, we have Yacenta Jackson, and Marcia Milliken is our final testifier. Ms. Jackson.
Hello?
Yes, we can hear you. Now you're muted again.
Did you hear me now?
Yes.
Hi, my camera's not working.
You can go ahead with audio only, and then we'll hear you just fine. If you can just say who you are and go ahead with your testimony.
Okay. Hi, my name is Yacenta Jackson. I work at Regis Hospital. I work a supply chain service. Thank you for letting me testify against this on my behalf. I'd like to say that I work at Regis Hospital and I deliver medical supplies throughout the hospital. And since the pandemic started, I've been working weekends. I've been working third shift, second shift. I've been doing overtime. And I feel that my life was in jeopardy because I'm here for the patients and we have to be here for the patients, make sure the patients are okay. So I was risking my life and my grandkids, like my kids, like coming to work on a daily basis and delivering supplies to the COVID units. You know, we was wanted to wear PPE equipment, but we couldn't buy PPE equipment, and we was going to patient rooms and bringing supplies to their room. And then they say that they appreciate all the work we do, but we really didn't see the appreciation because we didn't get no compensation for nothing. And when I go home, before I go to my house, I'll clothe myself, put my clothes in a bag, wipe my shoes down with bleach, put my clothes in a bag and wash my clothes. And I feel that we really had our lives at risk because we here making sure patients are being taken care of properly. But what about us as workers, as we come to work each and every day and risking our lives as well? So I feel that we should have been compensated with something, but we did, but we still came to work, doing our jobs, making sure the patients get all the medical supplies they need. And we just feel like something should have been done better because we did put our lives at risk and our kids at risk as well. And I didn't think that was right, you know, but still though, we was thinking about the patients and that was all we was thinking about is the patients because we feel patient care is first. And thank you.
Thank you, Ms. Jackson, for your testimony and for the work you did for everyone in your care. Next, thank you. We have Marcia Milliken.
Hi, I'm Marcia Milliken, and I'm the Executive Director of the Minnesota Children's Alliance. Thank you, members of the Frontline Worker Pay Working Group. The Minnesota Children's Alliance is a statewide coalition of children's advocacy centers, also known as CACs, and dedicated professionals who help children and youth heal from the trauma of abuse. We request that our victim advocates, forensic interviewers, mental health and medical providers, and multidisciplinary team members be included in the pool for frontline workers' pay. Each year, we provide direct service to over 2,500 children and youth who are victims of sexual abuse, trafficking, severe physical abuse, neglect, or who have witnessed violence. During the COVID-19 pandemic and shutdown, abuse and maltreatment didn't stop. In fact, both local and national experts in the field expressed concern that children may be even more vulnerable while isolated at home, limiting interaction with adults who might typically call in an abuse report when necessary. CAC services were declared essential and critical under Governor Walz's emergency executive order directing Minnesotans to stay home. Each of our centers remained open, providing expedient forensic interview and advocacy services throughout the shutdown. For the past year and a half, our forensic interviewers and advocates have remained nimble to ensure they and those they serve remain protected while providing consistent, quality in-person services. As COVID-19 and the Delta variant continue to impact our daily lives, CACs remain committed to meet victims' needs. Thank you for the opportunity to provide testimony and for considering CAC staff and team members in the Frontline Worker Pay Group. Please let me know if you have any additional questions or if we can provide information for your consideration. Thank you.
Thank you, Ms. Milliken. I would also like to point out that we received written testimony today. It should be available online from Aspire Minnesota, from Tammy Green, Aaron Walsberg, Corey Gooddyke, Lutheran Social Service, and Kirby Cruz. So for members of the public who may be watching, that information is available on the Frontline Worker Pay page under the Legislative Coordinating Commission website at the Minnesota Legislature's website. And there is a lot of materials there that have been submitted as part of this work group process. So next on the agenda is a discussion of the criteria and a conversation about next steps for how we move forward. And I think Senator Kiffmeyer, I think your hand was up for a question earlier, so I wonder if you might want to make that comment now.
Oh, thank you, Mr. Chair. I appreciate that very much. This is mainly just kind of following up on one of our first testifiers, a nurse. But a comment was made, and I appreciate her service. Nurses were really, truly frontline. That was just without question, very moving testimony. But in regards to hospitals having record profits, I had been in touch already checking with hospitals and their viability because of their inability to do many elective services and other routine kinds of work due to COVID. So I knew things were a little tighter for them. So I went and checked a little bit. I just want to remind everyone, though, that hospitals in Minnesota are nonprofit. So sometimes the word profit is used, but they are nonprofit. And then the median operating margin was 1.4%. It's been dropping for the last several years. It used to be around 4+%. So the main thing is just to mention, I don't see, have not found information here that says hospitals had record profits. And also in my conversations with them, I've also not seen evidence of record profits as well. I think they're a business like many others that have had a lot of changes and a lot of struggles. I just thought it'd be important to just clarify that on behalf of our hospitals. For now, Mr. Chair, that is just my comment. Thank you.
Thank you, Senator Kiffmeyer. So we are, this working group is approaching a deadline of September 6th. That is when the legislation says that we should have minority reports ready. Today is Thursday, the 26th of August. We have next week, a full week to work, and Labor Day is September 6th, which is when our homework is due. That means effectively that we can continue, really work through next week to try to reach some kind of a consensus. And I would say at the, after having heard a lot of testimony, considered a lot of policy limitations and data limitations and competing goals and so forth, we still have a lot of challenging work ahead of us to get this done on time. But I do think that we've all seen the same testimony. I really appreciate how consistent and thorough the working group has been in terms of showing up, listening, paying attention, being engaged, and really just sitting with the challenge of figuring out how to be fair and equitable in divvying up $250 million for workers whose experiences in some cases were of great stress, others of great risk, and still others great loss. And we've heard from all of them. And we know what we knew at the beginning, and we, I think, know even more powerfully now, that we cannot make up for what they went through with money. And yet that is the tool that we have available to us to recognize their service and work and try to correct some of the harm, the economic harm that the pandemic has brought. So we have a lot of work ahead of us for the next several days. I think my operating principle has been that unless this working group is essentially unanimous on an agreement, we will not be able to convince our 4 caucuses and the administration to have a special session and get this out the door. There's no automatic trigger of a special session. We have to come to agreement. And I just want to thank all of the members of the working group for putting in the time and effort and paying attention and listening to these experiences and understanding the challenges that we have ahead of us. So my hope is that we are now going to shift into a conversation about how to do this, and to do that both publicly here. I expect that we will have 2 hearings next week at the usual times. I think that we will shift to a hybrid format again, so that those who are able or comfortable being in person at the Capitol will be able to do that. I think that aids our conversations. I would encourage advocates and members of the working group to work between now and Tuesday to really come forward with concrete proposals for how to make this happen, so that we can try to hash out a proposal next week. I think we can do it. I think this group can do it. I think it's challenging, but we're capable of doing it. And I know that everyone here is trying to do the right thing with the money we have available for the most people that we can. So that's kind of the mission. I mean, I have a list of kind of a summary of criteria, some of which compete with each other, that we can go through. But I see that Senator Kiffmeyer and Senator Housley have their hands up. So I think I would like to hear from Senator Housley next, and then we'll go to Senator Kiffmeyer.
Thank you, Mr. Chair. I too want to thank all of the testifiers and what they have done to help heal and protect and trudging through this pandemic and continuing to go to work every day. Like I said in the last committee, I didn't know what I didn't know, and so getting to hear every different sector and what they did was really, really helpful and very insightful. So I want to thank everybody for testifying and for continuing to do your work. And I think too, we can come to a unanimous decision next week. We have to. We absolutely have to, in order to get this to a special session and get passed. So I think that's a great idea. I think we should talk with our staff and our advocates and bring everybody's testimony to the table and hash out some criteria, and then bring it all public next week in Tuesday or Thursday. I think that would work great.
And Senator Kiffmeyer, I would add that I don't think our charge is to have bill language drafted by Labor Day. I think if we could come to an agreement in concept, we could then work towards working through the details in bill language after next week. And we'll go to Senator Kiffmeyer next, but I'd also just be interested in hearing from other working group members, including commissioners, on that kind of framework for a path forward. Senator Kiffmeyer?
Thank you, Mr. Chair. You know, I'm open to either. Sometimes language makes it a little bit easier to work from something, and that's always helpful, just so we don't kill the messenger of the first draft, understanding that it's helpful sometimes to have something to start from and then adapt it. That's what we do in the legislature all the time. But I would appreciate, though, I think it's been a number of weeks since we had what is the legislative charge to us, and then also what are the federal rules. I think we have more of a discussion about that. And certainly, like, it doesn't have to be today, but focus on the specific charge.
Oh, Senator Kiffmeyer, you're breaking up a bit.
To make sure that we are focused. Is that better, or I'm just gonna? Okay, thank you. That concludes my remarks anyway. But I think waiting for whatever we can do with language, if anybody has anything at all, I think it's good. But I think making sure we're focused by getting renewed again on the federal rules and also our legislation, maybe the next meeting or sometime we could start with that. I think would be helpful to be sure we stay focused.
And Senator Kiffmeyer, I think that's a good idea. And I wonder if, the materials have been presented, and maybe it would be useful if we asked staff to forward again their kind of summary, a one-page summary of the legislation and potential federal rules. I think it's important to know the federal limitations. I also think it's important for us to remember that there are state funds that we could use if we want to craft a solution that wouldn't use all of those, only federal funds. So I think your suggestion of being guided by that is good, and I think we'll ask if we can circulate those documents again.
Thank you.
Commissioner Robertson.
Thank you, Mr. Chair. I would just like to say on behalf of the administration, it's been amazing listening to the testimony. Sometimes it has moved me to tears. Sometimes it's made the hair stand up on my neck. But the bottom line is there were many, it took all of us to get where we're at today. And there are many workers that have gone unnoticed in this process. And I think this work group has just put the spotlight on those nooks and crannies that kept the wheels going. And so I continue to advocate that we be as broad as possible in recognizing these workers. It took certain workers to allow the front line, the true individuals that cared for the COVID patients, but that's not the end of the story. And so I just want to continue to advocate for those workers that went unseen. Some of them went unrepresented, and just really look at how dynamic our workforce is and what it takes to keep the Minnesota economy going. It's been a struggle for many folks. Whatever resources can be allocated by this committee is only a real drop in the bucket. To me, it's more of an opportunity to just show some gratitude for the extra effort and the heightened exposure that different workers went through. Whatever we can provide to those workers will not undo and will not make up for the increased risks that they experience, the increased risks that they put their families to. But it is important that we stay open to the diversity of members that have come before us to state their case. I'd be really interested to see what actual proposals are out there. I think we will have to move the discussion along and really get down to the heart of the work, and that is determining who is included in a proposal for payout, and really diving deeper into the criteria that we started to discuss on Tuesday. My days are a little blurred, but as we continue to refine that criteria. I think that's going to be critically important, but I think we have to do that in fairly short order because it will take all of next week to really iron out additional details. So thank you.
Thank you, Commissioner. So when we, I guess for kind of framing it up, I think that we've heard a lot of conversation on criteria from the committee where we're pretty well aligned on the idea that this should be something that is administratively feasible, something that is centered in the workers themselves. We heard from Louisiana about the application process and the ways in which the state agencies were able to pretty efficiently administer that. We've talked about the need to recognize other benefits that workers might have received during this time period. We've talked about defining a time period in which a worker had to have been employed, a minimum number of hours, potentially targeting resources based in part on income, and the need to have been working in person rather than remotely so that individuals were actually exposed. And we've talked about the importance of maximizing the tax-free status of these checks if possible. I think the big question and the hard question is figuring out a way to draw. The advantage of asking workers to apply is that then we are able to ask them to present information or self-certify rather than needing to use state data to identify who all of those workers are, because our data availability is limited. So it does, I think, provide an opportunity if we're asking applicants to self-certify to be a little bit more careful in determining criteria for applications. So those are some of the comments that we've heard. I think trying to put some concrete proposals together, as Senator Kiffmeyer was describing, would be beneficial. I would ask that as we look to come together Tuesday, I think it would be helpful if we had something to look at before the next meeting and an opportunity for conversation amongst the working group then. And we have to be careful not to do that offline because we don't want to create a quorum and that kind of thing, but individual conversations can be part of this too. So, I think that will be useful. And I do hope that that conversation, by getting started Monday and Tuesday, we will be able to reach an agreement by the end of next week, at least enough that we can say that we've met our obligation and we can move to finalizing what this looks like. Any other comments from the working group? Well, I am not seeing any. I know that Senator Kiffmeyer is on her way south and Senator Murphy is on her way north. I spent the morning with Senator Kiffmeyer in Bemidji, and I'll spend the evening in Grand Rapids with Senator Murphy. And the rest of you, I look forward to seeing soon. We are adjourned.
Recording stopped.